Hi, I'm Audra Burns from Dartmouth-Hitchcock, and welcome to our Heads Up Coping Through COVID-19 webinar. This is our fourth program in our series, and today we will be focusing on concerns of those on the front lines of the coronavirus pandemic, from healthcare workers, first responders, to employees of essential business. Questions for our experts can be emailed to social@hitchcock.org or comment in the thread below. If we do not get to your questions, we will be posting answers from our experts in the comments and on an FAQ page on our website, which you can find in the description of this video. I'm joined this afternoon by two members of Dartmouth-Hitchcock's Employee Assistance Program, Dr. Steve Cole, Clinical Psychologist and EAP Program Manager, and Dr. Eve Zukowski, Clinical Psychologist. Thank you, Dr. Cole and Dr. Zukowski, for participating in the conversation today.
Thanks for having us.
Thank you. Glad to be here.
So, Dr. Cole, how do you think healthcare workers, first responders, and other frontline workers are managing the stress of working during the pandemic?
Well, I'd say, given all that we're contending with, I've just been amazed by the efforts to prepare and manage this health crisis here. It's just been amazing. We've witnessed over 3,500 staff members being trained with PPE, the protective equipment, right outside our offices. But when people think about stress, they tend to think about okay, not okay, all or nothing. And there's a model that's been put forward by the National Center for PTSD at the VA called Stress First Aid, which emphasizes that stress is really on a continuum from well and ready for anything to kind of stressed to more stressed, all the way, so from green to yellow to orange to red, where people are actually feeling injured by the stress. And we all move back and forth on that line. And the model really emphasizes that people are adaptable, that it normalizes reactions to stress, and it emphasizes that there are things we can do to help ourselves move back towards the green, or at least the yellow. The idea is to really destigmatize reaching out for the supports that are available.
Yes, I would agree with Steve. People do seem to be managing well. We're hearing lots of stories of resilience. We're also hearing how workers are proud of the way their teams or work groups are coming together to support each other. This is really for all essential workers, whether it be here at the hospital or the grocery store or the gas station. Having said that, there are some stress points that people are experiencing. For healthcare workers specifically, one major stressor is managing that PPE, or personal protective equipment, and the concern to be thorough with the protocols for that. But in general, for really all essential workers, coping with change as the norm is really very stressful. And as the COVID story evolves, so do policies and expectations, say regarding wearing masks, how many can congregate together, and who can return to work. And so having to adapt to constant change can be stressful. Mm-hmm. So all essential workers as well also have an understandable concern for their own safety, or the safety of patients or their customers, and the safety of their loved ones.
I've had questions with some family and friends who are both, in the medical profession, but also in essential business. And they all kind of have that same feeling with the PPE of, wearing that mask. It takes away that connection with people. And that's something they're struggling with too, because they're so used to being so intimate with relationships. And once you cover up half your face, it's a challenge. So I can understand that. And Dr. Cole, that's a great visual of the stress point of from red to green. If we can all focus on where we kind of land on that, it's kind of a good visual to kind of check ourselves of how we're feeling. So that was great. Thank you. So Dr. Cole, in your opinion, how has the pandemic impacted relationships between coworkers and teams?
Well, we all react to stress differently depending on our personality and our personal histories, particularly if people have had a history of trauma in their past. Some people get quiet and withdrawn, other people get a little bossy and critical. And I think the important thing is to learn to recognize how each of us responds and how our coworkers responds, and to give a little space for that, because we're all under stress right now. I'll say a few thoughts about conflict, which which I hope will help. The first is to give yourself permission to pause before responding. So if a coworker or a family member makes a snarky comment, you may need to take a moment, and you can say things like, I'm feeling kind of stressed right now. Can we talk about this later? It's important. Um, uh, and just give yourself that room to think and reflect. And the other suggestion I have is to stick to one topic at a time. Try to complete that topic of point of contention before you move on to any others. Coworkers can support each other by reminding each other to take breaks, just kind of looking out for each other.
Mm-hmm. And I think that also speaks to parents too, taking that pause moment too when we're all at home. We may not be with coworkers, but we may be with our children. So that pause moment
Right.
is definitely important. So Dr. Zukowski, is it common for essential workers, especially healthcare workers and first responders, to worry about their own well-being, and what coping strategies can they utilize for stress and anxiety?
Yes, it is common these days for essential workers to be concerned about their health. And of course, people don't want to get sick, but often healthcare workers or first responders in particular are more concerned about getting someone else sick. And so they put the needs of others first before their own. Many may feel an extra responsibility to stay healthy, to avoid getting patients or family sick. Sometimes healthcare workers can become kind of hypervigilant about their own bodies, and they may be monitoring and worrying about every nuance of their health, and this can become stressful and burdensome. So it's helpful to cope by having realistic expectations, focusing on what is controllable and doable and what you can do to stay healthy. Some things about the situation are not in our control, but there are many things we can do to build a sense of security and predictability. And in terms of coping, we like to emphasize, just the basics of self-care, good sleeping and eating habits, getting exercise, enjoying positive social connections. And we here at EAP like to give tips from the cognitive behavioral approach as well. And what that means is just recognizing and challenging worries that are unproductive. So stress can cause unrealistic thoughts, and high stress might even trigger a fight or flight reaction. And when that happens, we might get the amygdala hijacked. And the amygdala, is the part of the brain responsible for handling immediate threats. And that can cause thinking to become reactive rather than mindful or reflective. And so in that case, thinking might take the form of catastrophizing or overgeneralizing. And from a CBT approach, what we would do would be to challenge these unrealistic thoughts by reviewing evidence that either supports or contradicts that thought. And usually when we're anxious or overly stressed, there's usually thoughts that are unrealistic, and there's a lot of sort of contradictory evidence that challenges that thought. And so the idea is to build more realistic, self-affirming thoughts that can reduce stress.
Yeah, I would just add that I think sometimes healthcare workers, uh, particularly clinicians, can push their concerns about their own health too far away, and that's where it becomes important again to be able to remind a coworker to kind of check in with each other and remind them about self-care. I'd also say this is a good time to focus on positive health, so just simple things like drink more water, or people often say, well, I know I'd feel better if I could exercise, but I just don't have the energy these days. And I say, well, could you do 5 minutes, and it's not a lot, but it gives us a sense of accomplishment, and it can help to kind of turn the tides. The other thing I'd like to say again from that stress first aid model is that there are some strategies, some of which Eve have mentioned, things like doing the things we can to stay safe, washing your hands, wearing masks, social distancing, learning ways to calm your nervous system, like deep breathing or mindfulness practices, staying connected to others, giving and accepting support, focusing on your competence, what you do well, looking for small victories in each workday, and sort of collecting those. and trying to stay positive, which can be work. It takes some effort. You have to be intentional about it sometimes. Things like gratitude lists, and also maybe thinking about the long view of this. Like, how would you like to reflect back on this time 3 years from now? How would you like to feel about how you managed it?
Those are all excellent suggestions from both of you. Thank you for that. Dr. Zukowski, how can healthcare workers and other essential employees manage the transition between work and home?
Well, this can be tricky. It seems like many healthcare workers or essential workers find themselves wearing many different hats these days. Maybe when they go to work, they're a professional, but then when they come home, they become a teacher, a caregiver, or a homemaker. And if kids are at home, maybe they're involved in homeschooling, they're keeping the house organized and running when there are limits on getting out and about. So it's really important to build realistic expectations. You don't have to be a perfect school teacher or a perfect homemaker. And people are also finding that they're pulled into managing their family's concerns about COVID. Perhaps they've got children or aging parents that have their own concerns about getting sick. And they may also have concerns about the potential exposure they imagine that the healthcare worker and their family experiences when they go to work. So it's important to reassure people at home about the many safety precautions being taken at their work sites, and build in some predictability for family members. And in our house, we have people who have different reactions to the stress. I've got 2 daughters, and they're feeling stress in different ways. I've got one daughter who's a little stressed out, and she's focused on hunkering down and staying safe. And I've got another daughter who's an avid soccer player, and she's really got a serious case of cabin fever. So what we've done is we've tried to work hard to get everyone's needs met, and we've had lots of family meetings and discussions and rules about limiting social contacts and trips outside. And we also do a lot of reminding ourselves about social distancing, masks, and good hand hygiene. And so these rules that we've set have become a very reassuring structure that builds trust that, we as a family can manage this stress. And so that's one of the ways anyway that I've tried to juggle these different balls in the air about going back and forth between work and home.
Yeah, Eve, that reminds me of what a nurse related to me about her routine, that when she gets home from work, she takes all her clothes off on the porch on the outside, and there's a hamper out there. She dashes into the shower where she's got clean clothes, and the kids know, don't hug mommy until she comes out of the shower and she's changed her clothes. And it's, I think, kind of reassuring to everybody that that's the routine. The other thing that I would mention is for people to be intentional about rest. I think that's really important. And I say rest because when we're stressed, sometimes thinking about getting enough sleep can make it harder to get sleep. It's so psychological as well as physical. So I say just carve out 8 hours to rest, and it helps if you can keep the same schedule, which is not always possible for healthcare workers, but as close as possible, and to build in a little wind down time so you're not working or trying to get things done right up till bedtime, but give yourself 20 minutes to just relax before bed. And then if you're in bed and it's just not happening, you're not sleeping for 20 minutes, it's better to get up, go to a comfortable chair with low light, avoid screens, no TV, no laptop, and just do something relaxing like a crossword until you notice your eyelids getting heavy, and then go back to the bed. The other thing is to be cautious about alcohol and caffeine. Those things really affect the quality of the sleep. And if your problems persist with sleep, then you want to talk to somebody about that, because it's really important in these times to get enough rest.
That's great advice. I know I'm guilty of, if I'm not able to sleep, I pick up my phone, which is, I know, is a big no-no. So I'm trying my best to avoid that. And Dr. Zukowski, that was great information that you shared about that. We're all kind of dealing with this in different ways, and coworkers need to understand that too, that it's great to be able to check in, because we don't know how each of us are handling this. And I don't know about you, but I'm also becoming a really great soccer player, because my little son is desperate too to get out there like your daughters. We've been outside, so I'm getting pretty good. So we have a viewer question that came in, and this is for Dr. Cole. What are a few signs that essential workers should seek help for their stress or anxiety?
Well, it's a question of degree and duration. In other words, how severe and how long have these problems been going on? There's some questions that I ask that can get to this. If you're finding it very difficult to relax when you get home from work, like you just can't turn it off. If you've been having trouble sleeping for a while, if you find yourself withdrawing from friends and family, alone with your worries, or if you've been trying to cut back on your drinking and not feeling successful, then these changes may indicate that you've kind of moved into that red zone. And that's where it's really helpful to reach out to the available resources. Certainly if people are having thoughts of hopelessness or even thoughts of suicide, they need to reach out. No one should have to suffer alone. And there is the hotline, we'll put that in the chat box, the national hotline, which is 1-800-273-TALK. And people here, of course, can reach out to our program.
Yeah. Yeah, it's important not to suffer alone, like you said, and we will have those resources on our website as well. Dr. Zukowski, this email came in for you. What common concerns do healthcare workers and other frontline workers share as the communities begin to gradually reopen?
I do think that healthcare workers and other essential workers do have some concerns and are questioning what's going to happen as we gradually reopen, especially those who have been at home. They're thinking about what it will be like to return to work. And they may be understandably anxious about the unknown. They may be asking themselves, will I be more vulnerable to getting sick? Especially if it's a place where there are COVID patients. There also may be expectations about patients and customers gradually returning, what it will be like, and what will the expectation be for bringing things back to full capacity. Some folks who have been working from home may have developed a workable home routine, and now they're thinking about adjusting to an on-site work routine that accounts for the new normal, that is, social distancing, and hand hygiene and all the things that we've been put into place. And for healthcare workers, that may be including something like a combination of on-site work and telehealth. And I do think as well that folks have concerns about managing their patients' questions and worries as they return. I know here anyway, at the hospital, people are thinking about patients coming back who maybe have held back their care and are worried about coming onto the site and will have questions and concerns about returning. So there are concerns about gradually reopening.
Mm-hmm. So as we wrap up today, can each of you share a few important points that our frontline workers should remember?
Yeah, my final brief takeaway is to reiterate that it's important just to have realistic expectations, to focus on what is controllable and doable and what you can do to stay healthy. And along those lines, listen to your own boundaries about when to say no or yes to something that you're questioning, and work towards letting go of worries about situations where we have no power or control. And this is a way to stay positive and grounded.
Yeah, and I would add really just encouraging people to recognize that stress is a normal reaction to a situation like this, and we're all going to feel kind of crazy at some point. And it's all about what can we do to kind of move back towards the green or feeling better. One quick exercise that I show clients is a deep breathing exercise. There's a many breathing exercises. This one is just very simple. You just take a nice deep breath in through the nose and then hold the breath, and then through pursed lips, like you let the breath out very slowly, like you're deflating an air mattress. And what that does is it changes our focus and it changes our physiology. So we actually have a chance to calm the nervous system.
Excellent advice. Thank you both for your incredible information and your tips and tricks for all of us to deal with this. So thank you so much for joining us today.
Thank you.
Thank you.
And thank you to all our other frontline workers and essential workers, and for all of you for tuning in. Next week, I will be joined by Dr. Robert Brady, Dartmouth-Hitchcock's Director of Anxiety Disorder Service, Dr. Will Torrey, Professor of Psychiatry at the Geisel School of Medicine, and Ken Norton, Executive Director of the National Alliance of Mental Illness, New Hampshire, to discuss challenges that adults are dealing with stress of mental health concerns that they may be experiencing. For a full heads up coping through COVID-19 schedule, as well as the resources that we mentioned below, you can see our website on the comments. And we want you to stay healthy. We want you to stay safe. Let's take a moment to set realistic expectations, like Dr. Zukowski said, and like Dr. Cole said, let's just take a moment to have that breathing exercise. I think it could all do us good. Thank you so much, and see us next week.
Bye.
All right.